very much. Thank you so much for having me. I've really been looking forward to this. You are the doctors who make getting up and coming to work worth it, because you get it, because you're not victims, because you care about what you do. You're not going to let somebody dictate to you. And that's what we all need to, we need to pass this along to our colleagues who've been beaten down, who've given up, who decided to take a paycheck with the hope that everything will get better, when we all know sitting in this room that it's not going to get better. We've just heard lecture upon what's going to happen to the healthcare profession and to doctors in general, but I actually think we should think outside of the box, and I think that the Affordable Care Act may be the best thing that ever happened to medicine, because it's going to force us, one second, it's going to force us to stop, doing the same thing, expecting a different result. We now have the power, because this thing is such a disaster. It's going to fall apart. People are already seeing that having health insurance does not equal access to health care. And our job is to let them know that, educate them, teach them that just because you have your card doesn't mean you can afford to see me. This past summer, our practice took a major hit when Affordable Care Act really went into full bloom. And we had a lot of people make appointments, get to the office, find out that their insurance was $1,500, $2,000, $6,000, $10,000 deductible before the insurance kicked in a single dime, and they left. So I might have a whole slate of patients, and we saw 2 by the end of the day. Well, it was a wake-up call for me as well. I mean, I've been on the front line, I've been talking, and I realized something really very important, that I'm worthy. I'm worth it as a doctor. You should be happy to see me because I care about you, because I practice the Hippocratic Oath and I'm not giving it up. And I now want to partner with patients who get it, and they're growing. That's the cool part about this. We have the opportunity now to take control of our profession once again. And I don't think that we have to work harder to do it. I think we need to find new ways, new avenues to do it. There's more than one way to do this. And Dr. Josh and Dr. Gross are 2 of my heroes, because I've started to incorporate a lot of what they do in their practice in mine. But I'm doing a lot of different things. I barter. I still accept insurance. I actually have joined medical cost sharing. I'm not sure that a lot of doctors know about that. But there's a company called Liberty Health Share, which is, I guess it's about 15 or 16 years old. And it initially started off as a Christian-based organization, as most of the cost-sharing groups did. And maybe about 5 or 6 years ago, they changed their model. And they realized it was about liberty. And anybody who wanted to take responsibility for their health, anybody who wanted to have control over their pocketbook, and wanted to stop having some third party decide who lives and who dies, that they were going to work together. We're going to pool our resources, and we're going to decide who gets covered and what gets covered. I just saw my first patient about a week ago, and I can't wait to see more. So this patient comes in, she pays $199 a month. Her out-of-pocket is $500 total for the entire year, and she's covered at 100% of any medical procedure, any medical visit that gets done throughout the United States, upwards of $1 million per occurrence per year. Done. So when that patient walks in and we decide together that she needed a septoplasty, all we did was call up the company. They said, she's covered, $500 deductible, you really don't have to do anything else, you don't have any codes, nothing, just submit it. And in a month's time, we get paid 170% of Medicare. That's the rate that they pay. This is no begging to take care of your patients anymore. An office visit is 160% of Medicare, flat. A surgical procedure is 170% of Medicare, no questions asked, and if you don't like the rate, you'll negotiate with them. You might say that's not enough, and they'll work with you. They respect me. Whoa, what that's awesome. So I can now tell my patients who have $5,000 deductibles and $10,000 deductibles, you know what, maybe you should think about medical cost sharing, because you can spend $199 a month, you can pay $500 maximum out of pocket, $1,000 for a couple, $1,500 for a family. $299 for a couple, $399 for a family of 3 and above, and you're covered. It's not insurance. That's what makes it beautiful, because you don't have someone telling you what you can't do, what you can't have. It's all about you and your doctor. That's another way to think about direct pay. If we empower our patients who somehow can't get out of the insurance mode where they think they want to pay a monthly to something, that they're actually not only going to have to, or not just going to have to pay it, but they get value back. That's a difference. And if you couple that with people who don't carry insurance and you have a monthly subscription, or you have ways to do for ENT, a lot of our stuff is procedural. So I offer flat fee for multiple procedures in my office. Anything that I can do and involves my intellect or equipment that I own is covered under their monthly. So for $50 a patient, $10 per child, they can have any kind of endoscopy, hearing tests, allergy testing. We even have a pharmacy in our office. So this is really all about keeping it simple, keeping it affordable, making the patient, giving them their power back, and by definition, taking our power back as physicians, because it really does come down to whether we value ourselves or whether we're going to let somebody else put the value on us. And I'm personally not going to do that anymore. So, thank you. So I think the first way to get to that is to have a plan. It's daunting to think about changing your practice and asking people for money. That's the first thing we need to get over. It's hard. I mean, I don't even go to the front desk. I used to not go if someone had a deductible because I didn't want to discount them because I feel bad. Get over it, right? You're providing a service, and knowing that you're providing service head and shoulders above the mills that are out there, where there's physician assistants, nurse practitioners who don't even know how to write a prescription properly. I've seen that. And charging exorbitant amounts of money, where you're sitting with that patient, you know them, you know exactly what the medical problem is, and you can fix it. It's okay to charge them, okay? I mean, I think we need to get over that we need to just nickel and dime ourselves because we've been so beaten down to think that our value is nothing and that it's all about the bigger picture, the hospital, the insurance company. I don't subscribe to victimology, ever, and I never will. And this is the first step to making that change in your mindset. The second thing is finding patients who want to come along, because there are a lot of patients out there who want us to just write a prescription, call it in, whine about their $10 copayment, like you stole it from them. I'm done with those patients too. They can go somewhere else. I mean, we have to be partners. And if I respect myself and I respect my patient, I get it back 100-fold. And it makes it fun to come to the office. It makes it like it used to be when I was practicing medicine, not doing algorithms and having some insurance company, somebody denying care who's a pediatrician or a psychiatrist for an ENT procedure. I'm not doing that anymore. And now that we have the ability to educate our patients, it gives us the ability to do what Dr. Gross did, cut these insurance plans. The only reason this thing exists is because we've been polite, because we've said, oh, I'm not going to make waves. I don't want to be an outlier. I don't want to be, different from the rest of the crew. Well, it's going downhill. If you really want to go on that train, have at it. But we still have the chance to get off of it. We have the chance to pull it back. And quite frankly, I've been on a lot of shows, and I've been on with people who are for Affordable Care Act, and you're racist and you're sexist and you hate people, you want them to die, all the things that they tell you, when actually it's really the system that wants all those things. And if we actually now educate these folks, I think that there already is a two-tier system. I want to be part of the tier that works, the part of the tier that helps people, because the other part of it is hospice-driven, Accountable Care Act-driven, algorithm-driven, conveyor belt medicine. If anybody, I know there's nobody in this room who wants to do that. It's not hard to make the step. You're listening to people who did it. I mean, ENTs, you would think we wouldn't be able to do procedures, no one would come. But now the key is to keep it out of the hospital. If you control the service, you control the cost. And I can tell my patients, just like Dr. Gross did, that it's cheaper not to access your insurance. In Atlanta, where I practice, we can send patients to surgery centers where it's 70% discount for fee-for-service, $250 for a CT of the sinus, labs that are $10, $15, and that's even before, I'm not going to bring it back to my office, so it's going to be even cheaper than that. So actually getting quality care, this is the education point. It's cheaper not to access your health insurance than it is to pay cash. If you can get that out to the patient, they'll come. It's like build it, they'll come. Same principle. But they've been miseducated because it's all about control, about collectivism, about top-down, and about crony-driven healthcare that's cost everybody everything. It costs us our freedom from being able to treat our patients the way we were trained to. We've got maintenance of certification, scams set up that's gouging us. If we continue to, again, that's the mantra. Silence is complicit. If we stay silent, they'll keep doing it to us. If we're polite, it's not going to stop. It's only going to get worse. And ultimately, we have, I think, about a window, maybe 3 to 4 years, where if we opt out, stop playing the game, which is rigged, it'll fall apart on its own weight because they don't have enough doctors to fill it. They don't have enough nurse practitioners, physician assistants to fill it. And another thing that we need to really be aware of, we're not providers, please. Stop letting them call you a provider. Jeez. Like we're all equal, like we all train the same way, like we all have the same mindset. We don't. And I'm not saying that being a nurse or a physician assistant is a bad thing, but when I trained, they were extenders to the physician. They carried out our plan. We were involved with the patient. These guys are running on their own now. They're seeing patients, they're doing procedures, they're writing for, narcotics, but I still think the buck falls with us. So when they screw up, we still get the heat. So let's really just remove that from the lexicon. Correct people when they call you a provider, including the insurance company, because we're not. We all have a role to play in healthcare, and everybody, it's a team, but it's not the accountable care team. I don't believe that. I mean, we're just all kumbaya and getting together. I mean, that's ridiculous. It's laughable, actually. Take your power back. That's all I have to say on that subject. So I talked about medical cost sharing. If you want to go to a website called libertyoncall.org, you'd actually be able to talk to somebody and figure out how it works. Another little aside is from my practice, because I'm a solo practitioner. I love my employees. They've been with me for years, 10 years and above, and I want to cover them. And I found that under Liberty HealthShare, by covering them, it also, I didn't mention this, but it's allowed under the Affordable Care Act. That's their little loophole. They thought no one would pay attention to it, but it actually works. And if you put that on your tax return, you will not get dinged with fines. It's allowed. It's one of the carve-outs. So I say we use this to our advantage. You let patients know about this, which would stop them from saying it's too expensive to have the procedure or to buy the medication. All these things empower the patient so that you can literally carve out and opt out of the system without fear. So that's one thing that's really interesting that I think most doctors don't know about. And if you were able to actually see less patients, not worry about your payroll, be able to not be on the phone or hire an army to be on the phone to argue with these people, we would actually get the love of our profession back. And it only takes a few percentage points of doctors to make a difference because the sheep will follow. Okay, we need to be the leaders in this, but not the silent ones, the ones that are out there in front screaming, I'm not doing this, you can't make me, and I refuse. Opt out, literally. I use the analogy on my radio show of the scanner in the airport. I haven't gone through those things once. I cried the first time that they tested or checked me, and now it's a badge of honor. And it turns out that if 6% of people said, I want a pat down, they wouldn't run the machines because it takes too long to get people on the plane. So it doesn't take a majority of us, it takes a very small, vocal, committed, just like this group, committed. Now you guys are all here learning about how you can make this work for your practice. I honestly hope you go out and do it, because it's really key. So, in terms of cost of running the practice, I think that most specialists, especially office-based specialties like ENT, basically own a lot of their equipment, which takes the onus off of offering free services. I think that's one thing that if you do run a practice that has anything that has to do with procedures, if you can own your equipment, if you can keep it all in-house, it makes it much easier to lower the cost of doing business and passing that cost on to the patient. So, in closing, because I guess I got off my little bandwagon a little bit, but I love what I do. You guys love what you do. This is not a joke to us. This is not something you can go out and do something else if this doesn't work. We now have the opportunity, this is the nexus where we need to make decisions that are in our interest and in our patient's interest. And they're not hard anymore to do. Dr. Josh, Dr. Gross, Dr. Smith, all of these guys have gone out there and done this for us. I mean, we've got all these models that we can copy and pay attention to. And I think what we really need to do is figure out what works best for us. And the second phase of this is to educate your patients. Stop whining in private, Let them know why you're unhappy or why you're dropping in insurance. If they know you, they love you as their doctor, they wouldn't be seeing you, they trust you. They're not going to listen to MSNBC or Fox or whatever these other pundits talk about on TV who know that just drives me crazy. They know nothing about medicine. They're talking like they're out there in the front line, pulling charts and seeing patients. They have no clue. And as long as we let them be our mouthpiece, we're going to end up behind the 8 ball. So I say cut the middleman out in terms of the media, the insurance company, and start handling your patient as an individual like you want to, and have them, those that get it, stay in your practice, and those that don't, it's really awesome to get rid of them. It's really awesome to get rid of them because it makes your life so much better. Thank you very much for your time. I really appreciate it.